I'm continuing to present on borderline personality disorder, and this video is called Trust Your Body and Your Doctor. The borderline often harbors self-doubt, questioning his judgment, and distrusting his feelings. Similarly, the borderline may distrust his own body, at times acting paranoid, as if the body is out to get him or undermine his ability to enjoy life. Borderlines are constantly fighting unwelcome or unpleasant thoughts and feelings, but also body pain and discomfort. Borderlines, as noted earlier, tend to have multiple physical complaints or somatic issues, particularly regarding gastrointestinal discomfort, headaches or migraines, general aches and pains, and complaints of fatigue and low energy, feeling unable to face the challenges of everyday life. For this reason, I always ask clients, how does your body react to anxiety and stress? Stress can be psychologically and also physically toxic. The mind-body debate ended decades ago when it became clear that the brain is an organ within the body so that all thoughts and ideas occur within the body. It is a single unit of multiple interfunctioning and inter-influencing systems, all of which have a neurophysiological impact on behavior, emotion, and thinking. So it makes sense that when your arm hurts, you feel psychic pain because of the neuromuscular system, and so too, when you feel anxious, your arm may hurt because of the same feedback system. If the borderline can develop a language for his body pain, physiological distress, it may help stop the internalization of psychological pain, and this may in turn help destroy the facade of inauthenticity. Art therapy can be helpful because it allows unadulterated internal issues to be expressed in art form externally. The goal is to reduce stress in the body as much as to reduce psychological stress, allowing the body's regulatory system to become accessible and function unhindered. In general, it is important for the borderline to separate the symptoms that comprise BPD from his personal humanity, because without humanization, the individual can be swallowed up by the illness. The borderline who believes he has a medical issue should seek a medical opinion. However, if the doctor determines there is no medical issue, then perhaps there is no medical issue. It is important that the borderline does not become his own doctor and second-guess medical opinion, or even live in fear and anxiety because of internet information. Yet, there are a few exceptions and caveats to this. First, medical error is not uncommon in the United States, and seeking a second or third opinion can be crucial. Second, revisiting the problem if it does not resolve may also be wise. Internet information can be indeed informative at times and sometimes provide actually opinions and options that doctors do not. I had a very painful foot issue and doctors suggested various over-the-counter prescription medications, some of which were expensive and had various degrees of effectiveness. I chanced upon curcumin as an anti-inflammatory agent which yielded better results than anything prescribed or suggested by physicians, and it is cheap, it has no side effects, it can be taken any time of the day and with any meal. There is scientific research supporting the use of curcumin, yet the reason doctors do not suggest it is because Big Pharma has an oversized influence on medical practice to the detriment of patients and, frankly, the entire healthcare system. Overall, the body has a science fiction-like capacity to heal and maintain homeostasis under normal circumstances, and constantly second-guessing how the body functions and whether it is functioning properly is often unhelpful, so that deference to physicians who know better is often the best path for borderlines.